Good afternoon, Jordan, and thanks for agreeing to participate in Access 23.
Yeah, well, thanks for having me today, Olander. My name is Jordan Noyes. I'm the Director of Supply Chain Procurement and Contracting for the Marshfield Clinic Health System. We're a medium-sized healthcare system serving rural populations in central and northern Wisconsin primarily. I've been in my current position for about 3.5 years. I've been with the system for about 4 years and have some previous experience elsewhere within healthcare supply chain.
So, Jordan, from your perspective, based on what was considered the collaborative scope and working with the likes of Marshfield Clinic, what would you consider to be the ask and what you were hoping to accomplish and what your needs were from that of Vizient?
Like a lot of healthcare systems, across the country and really the world now, we're doing everything we can to, cut our costs wherever possible. Historically, we haven't done a great job up until now of really driving for the best costs in a lot of areas, especially the PPI areas. We're pretty wide open. We have a lot of vendors, a lot of products, and we really needed a partner to come in and help us, identify areas of opportunity as they relate specifically to cost savings. We needed somebody with a lot of experience and breadth in the sourcing categories or areas for PPI specifically, and a lot of clinical areas to come in and assist with some of the larger projects we had envisioned. So we thought a partner like Vizient and the Aptitude team would be perfect for that. They were really checking a lot of boxes for us.
So, Jordan, thanks for that background. We hear, this type of concern as well as needing of solutions from a lot of our members. So the combining of what is considered that clinical expertise and working with the supply chain team, physician end users, and partnering that expertise with some of our technologies like that of Aptitude helps us to help you as a member and provider to be more successful. So, Jordan, how would you say to date, based on the active initiatives that we are currently working on and how we're employing and utilizing the Aptitude platform, if you find that to be of benefit?
Yeah, the Aptitude platform seems to be extremely beneficial for us. Although we're early in the adoption phase, one of the areas that we're looking at or working on currently is total joints and then the related bone cement. Their Aptitude seems to help us conduct business, help us conduct the RFP. One thing I really like about the Aptitude platform is standard terms and conditions that come with a lot of the suppliers. So a lot of the suppliers do partake in the Aptitude platform, and that speeds up our, I guess you'd say, work on the back end, our contracting work on the back end. It's very similar in a lot of ways to the Vizient national agreements, where it doesn't require so much legal review on our end. So it just facilitates business, and it makes what we're doing a lot more efficient and cuts down that timeline. Having a tool like Aptitude, where you can, conduct the RFP, conduct the sourcing piece of it, and then conduct the contracting piece of it as well. It's so beneficial for us, and it's not like anything that we've utilized here at Marshfield in the past.
No, that's good to hear. Your response is very similar to other members that have, utilized that of Aptitude value with utilizing the platform with those suppliers that are part of Aptitude with those sets T's and C's on terms and conditions. Saves a lot of time, and time oftentimes in the hospital and healthcare setting equates to dollars, right?
Absolutely, yeah. It not only helps us, immensely in supply chain, but then some of our downstream, partner departments within Marshfield, legal being one of them. Legal is I was inundated with a plenty of work, just like everyone else. So by having these templated terms and conditions, as you mentioned, it speeds up their process, and it doesn't cause them to be a bottleneck for the whole entire process. So it not only helps my team, within sourcing and contracting and supply chain in general, but it helps our sister departments too. And as you mentioned, I mean, that time saved is invaluable. It's the opportunity cost, of course, of what my employees could be working on, as opposed to reviewing and redlining documents.
So, Jordan, We have a pipeline that we're working on together, an integrated pipeline. We have a number of initiatives outside of Total Joints that we're going to be working and utilizing the likes of the Aptitude platform. What are some of the other things that you're hopeful to achieve?
Yeah, one of the biggest things I'm hoping to accomplish through this partnership is really establishing a new culture within not only within sourcing and contracting, but within supply chain and within the organization as well. By bringing the Aptitude platform and the Aptitude team on board, we're really kind of I guess you'd say paving a new path for how we approach sourcing and contracting at Marshfield. We're a relatively younger supply chain. In the last 4 or 5 years, we've really experienced exponential growth from the clinic side actually into the hospital side. So, although we have a lot of great people with great experiences and stuff, we're going through a lot of growing pains where we're trying to mature as a supply chain. So much of what we've done in the past has been and I hate to say it, has been reactive. A contract is coming up for expiration. So that means, okay, we need to either extend the term out on it or renew it in another fashion, essentially covering the basis, ensuring that we had products on contract or services on contract. With Aptitude, it allows us to proactively take a look at categories from a more strategic perspective instead of the operational perspective. And by utilizing Aptitude and the Aptitude team, we're really kind of establishing a new way to do business, a new culture of proactively looking at categories, identifying opportunities, and working through those. Since we've started this partnership, our relationship with our business owners has gotten that much stronger because we're having more regular meetings with them. We're having more regular communication with them saying, hey, this is what we're thinking about doing in your affected area. Can you give us some feedback on that? And so those are benefits that we're already realizing from this partnership. I only expect it to grow from there.
So, Jordan, I really appreciate the opportunity to have, this conversation and to get your take on our collaboration, what healthcare systems are challenged with today in the supply chain, as well as perioperative setting when it comes to contracting, going out to RFI, RFPs, things of that nature. We're finding that, more and more healthcare systems today are faced with the challenges of how do we, implement better. How do we go to market better? But it's good to know that there's, healthcare systems out there like Marshfield Clinic that are willing to take on and look at, employing other efforts with the use of technology like that of Aptitude, partnered with that of clinical expertise.
Absolutely, yeah. Well, this is especially in today's marketplace and economy. If you're not utilizing all your resources, going out seeking those business partnerships such as this, you're not going to survive very long. And I think Aptitude in and of itself was a perfect solution for us. We tend to continue to utilize this service, as we go forward here in other areas beyond Total Joints, beyond everything else we have on the roadmap, being integrated with everything else Vizient has to offer, utilizing the analytics and everything that we already partner with Vizient on. It was just a no-brainer for us, and I look forward to a kind of a long partnership here.
We look forward to the continued partnership, and if there's ever any opportunity or a point within our collaboration that there are additional needs for possible enhancing anything that we provide to you as a provider, just let us know. But really appreciate your willingness to meet with us today, as well as to provide a point of view as it relates to how you're utilizing our expertise as well as the Aptitude platform in itself.
Great. Yeah. Thank you for, everything that you guys have done already. And I look forward to continue working with you.